Hi, my name is Makayla Breen, and today I am going to discuss asthma management and its importance, but more specifically, why it is so important for individuals to be informed of their treatment options and self management, and how education is to be utilized more in a healthcare setting and how it plays a significant role in self management of asthma. In a healthcare setting, such as the medical center, where there are general practitioners and doctors, it is known that these clinicians have a role of educating patients regarding their condition. However, the question is how much education is enough for a patient to fully comprehend and understand all aspects regarding management and treatment, considering that all patients and individuals require different teaching levels and mechanisms to be able to fully understand certain things, especially asthma treatment. All individuals are different. Some people are visual learners, others rely on heavy loads of information and are theoretical. Therefore, I believe when clinicians are educating patients on their condition and how to self manage asthma, it is important to include a variety of strategies and learning techniques in order for the patient to grasp what is being taught to them. At a general medical center where a patient would go to see their general practitioner, it is often a busy place, and many people are booked in to see a doctor, so often time is limited. Therefore, when it comes to educating a patient, clinicians often use their clinical judgment to make assumptions regarding the patient's knowledge on knowing how to manage. The specific change recommended in this case would be to increase the amount of education. This includes collaboratively creating a written action plan to treat so that the patient understands regular medical reviews around every 3 months regarding the patient's management, and together going through and utilizing the different educational resources such as brochures, pamphlets, and even websites in order for the patient to be able to make the best of their learning experience and take the most out of this. Increasing the amount of education during appointments is time consuming, but it is well worth it as it will lead to improved outcomes for the patient, which will ultimately lead to reduced visitations to the GP. The patient will also learn new things regarding their asthma that will further increase their overall confidence within themselves to be able to have some form of control over their condition. When individuals are not educated enough of their asthma or they do not understand all aspects of management, this tends to lead to non-compliance with their medications and treatment, leading to poor health outcomes and increased visitation/admissions to the hospital, medical center, or emergency department. In an article made regarding the self-management of asthma and how education is the biggest factor in improving health outcomes for people with asthma, it is mentioned in this that it stated that emergency room admissions were at a higher rate at 24.5% for individuals with asthma who stated they did not receive quality education regarding the self-management of their asthma from their GP that they could not understand. This is compared to individuals who did state they received an adequate education from their GP they were able to understand. 11.4% required hospital visitations regarding asthma exacerbations during the study period of this article. In this time, this was reduced to 7.1% with the use of increased education during their time with the GP. It is shown that education has a significant impact on objective health outcomes and contributes to the overall reasoning behind reduced hospital visitations and admissions. Hospitals are busy places that cater for most emergencies, and it is of a big help when conditions that can be controlled are managed efficiently. It is understood that there are complications with asthma, and it's not always going to be a perfect journey of self-management, and there may be times when it is an emergency. However, it is reported that the number of ED hospital visitations were due to lack of self-management of people's asthma. Increased education during GP visits allows for the patient to be aware of the effects of asthma and the consequences that come along with the neglecting of proper self-management of asthma. During visits and appointments with the GP should demonstrate how to, for example, use a puffer or inhaler, and then assess the patient demonstrating how they would use it. This is an efficient way of assessing the patient and an element of self-management. If the patient is successful and knows how to use the inhaler correctly, it creates a basis and further knowledge can be implemented regarding self-management strategies. And then this can be further assessed and practice makes perfect. During appointments with the GP, it is best for the GP to try and tailor certain educational strategies to the patient that will keep them interested and utilize person-centered care. Person-centered care refers to engagement, shared decision making, having a sympathetic presence towards the patient, providing holistic care, and working with the patient's beliefs and values. Utilizing patient preferences and overall person centered care will enable the patient to feel open and be honest with the GP. This allows for better outcomes for the patient's asthma management, which will overall improve their health outcomes. Furthermore, technology is a concept that intrigues most of society these days. Therefore, GPs should be encouraged to recommend any websites for patients to look through at home and utilize the websites during appointment time to use as a guide to inform patients of asthma, asthma treatments, and the overall management of it. Technology and current websites, such as the National Asthma Handbook, are examples of useful educational resources that should be utilized by GPs, as they are reliable and accurate and include other sites and resources to further educate individuals on all aspects of asthma. Education is a significant factor in contribution to improved health outcomes in referral to the self-management of asthma, and technology can contribute to this. It is necessary for GPs to take advantage of education and resources to help inform all patients and generally ensure they are aware by assessing their skills and knowledge by asking questions. This ultimately leads to patients feeling confident with their self-management and helps to reduce poor health outcomes. Thank you for listening. I hope it is understood that the implementation of increased education is necessary during GP visits, which ultimately leads to improved health outcomes. It is documented that the majority of asthma related admissions to hospitals is due to lack of self management, due to patients not having enough education and confidence within their own self management. Increased education is necessary and can be accomplished as it ultimately will help save lives.